Assalamu alaikum, everybody.
Wa alaikum assalam.
Yes, thank you very much for inviting me to speak about a topic very close to my heart and the experiences that we have had recently. It's a really good opportunity to share that. But I really feel privileged to be discussing this with this group of professionals, highly skilled professionals, many of my old friends that I'm seeing now in the group, and those who were students before, now they have qualified, become specialists, and some of you are actually public health specialists, and that makes me even more proud. So I'll share the screen with you if I'm allowed.
Yes, please.
It's not allowing me. If you can just.
Can you try right now?
Yes. So, all right. Can you see my screen?
Yeah, we can see it.
All right. First of all, I must congratulate all of you in Tanzania for a job well done. And the whole world is still trying to figure out what magic you played and learning from your experiences. So thank you. Please give us all those lessons. So we know that the disease has now spread to all parts of the world. Just a few days ago, Lesotho had its first case. And number of reported cases globally are over 6.7 million with over 330,000 deaths. And several parts of the country, I was looking at the statistics this morning also, globally, it's still rising quite fast, and new hotspots are coming up. In Kenya, just like in Tanzania, the first case was detected just a few days difference from Tanzania. It's in the third month of the epidemic. Until today, they've just announced over 2,400 confirmed cases. So we know that these are just those who are tested and found positive. They are symptomatic, asymptomatic among them. And there are many more out there in the community, since it's the phase of community spread, who are still not detected. And literature is showing that a very high percentage of people infected are actually asymptomatic, but spreading to others. This is really a once in a lifetime crisis for us. It's such a huge challenge, and all of us have been affected in one way or another. And why I'm saying it's a huge challenge, because even in terms of scientific aspects, in terms of our public health systems, not just in terms of health systems, but all other systems in our lives, our economic systems, our education systems, our personal lives have been affected drastically, and our lifestyles have changed overnight. However, later in my presentation, you'll see I'm presenting on what opportunities also that it's presenting. It's not just the challenges. And what we had been trying to do for years Suddenly, this tiny unseen virus is giving us some solutions to those years old conundrum. But one big thing that it also brings out is the ills in our society, the iniquities, the disparities, the prejudices and biases that we have in our society. And it's bringing those issues out for us to now deal with it, and also provides opportunities for solving them. So there are many small organizations and individual social workers who actually just closed shop and stayed back because of the huge challenge that this disease, this pandemic is throwing at us. The difficulties in actually going out and doing things with people. But there were some who took up the challenge, strategized, got together in small teams, and continued to work with the target communities as they had promised them. And this is one such story that I'll be telling in this presentation. So globally, we know this is a new disease, and there are differences of opinion on how to handle it. There are those countries, Sweden, Netherlands, UK, initially, they went the open way and not putting down any strict measures of lockdown or physical distancing. And then there were others who actually clamped down very hard, the Chinese way, or different modifications of those. So for the decision makers, for the leaders in the country, for leaders in organization, this really brought about a decision-making puzzle that how do you decide on what to do in populations so that this disease does not spread more, or it does not cause the kinds of health issues and problems that we are seeing with the disease. So there's need for more information, there's need for research and getting new knowledge on the virus, on the disease, and the effects of the different reactions that people and nations are having towards it. There have been new guidelines and revised guidelines already in just a couple of months' time, protocols and guidelines for health workers on how to manage the disease and different treatment algorithms. The economy has really been hit very hard. All over the world, every country has been affected. There is much higher debt now than ever before. As it is, just the continent of Africa had a debt of over $7.5 billion just to service its debt. And now along comes this virus to create even more havoc on it. There's increased hunger, definitely immediately because of this epidemic entering different countries. So it's estimated that just this year alone, more than 130 million people will be added to the already millions who are going hungry. Just in Kenya, last month they had announced that 1.2 million extra are going hungry because of this. And I'm sure it's similar in many of this neighboring countries. So I was listening to a webinar a couple of days ago from the Harvard Business School, and one of the panelists was mentioning, are we going the Arab Spring like revolution this time? Will it become like that? So we all have to get together and work out a way to actually prevent this happening. There are weaknesses in infrastructure and system which have been revealed by this epidemic. And I'll be talking a little bit more in the case study itself. So with the spread of the pandemic, the communication issues, there are issues of community engagement. How do you do that with all the restrictions that are there? And what are the competing priorities that communities themselves have in terms of their food, shelter, healthcare needs, needs for their socializing, for example, when they have funeral services, etc. Community monitoring can be a challenge for suspected cases, and determining mortalities within communities. Already, we know in Africa and other developing countries, it's been a challenge. So this adds another layer to that challenge. Implementing distancing measure in slums. In the slums in the cities where people are living in very tight, small houses, as you see in the picture over there, there are inequities being exposed. The rich versus the poor. If somebody who is affording gets sick, even for COVID, where would he go? So the same people who actually have been responsible for health services and hospital services in their own areas, would they be willing now to get services in their own areas? Or would they fly off and go off to the cities for care? And what does that show? Would that show that they are not trusting the services they themselves were responsible for? In terms of gender-based violence, that had been predicted even before, with families now living 24 hours or most of the time together at home, and can cause rift within families. Or on the other hand, there are opportunities also in improving family life. So it's a long haul. What new norms will there be that will now have to change our lifestyle? Will it change our culture? Will it change the way we have our religious ceremonies, for example, our work situations? Reallocation of resources. So in this emergency situation, there has been a lot of reallocation of resources. So you see in the cartoon, even the mosquitoes are complaining about it. But that's something to watch out for, so that we don't do more harm than the good that we want to, simply because now we are focused on COVID. It should not become another vertical disease like other diseases that we had then difficulty in integrating within one health system. And it took decades to actually get near to doing that. So what are the advantages? There's what is called the African advantage, the demographics. It's a younger population. We know from the lessons learned from the other countries which had the epidemic before it came to Africa, that in those countries it has been hitting the older population more. Those with comorbidities are getting more critical disease and dying. But in Africa, it's mostly a younger population. There's low population density in many areas, fewer comorbidities among those who survive older age. And maybe the weather. So that is also being considered and discussed, but there is no certainty yet. As we go into a different season, we are watching and will be seeing whether it does truly have that kind of an effect. Some countries did, some countries didn't have that kind of effect. So maybe it is a weaker, it has a weaker effect than other variables. We can take lessons from the past, especially from the flu epidemics, and lessons in the past economic hits also. So as national level or community level decisions are being taken, those lessons from the past have to be taken into consideration, not in terms of just the pandemics or epidemics of before, but also the economic recessions that have happened and how people got out of it and what decisions were taken. Countries more and more will now be de-globalizing. There's opportunity to look now inwards, and though that was a theoretical thing in the past, now it is a reality, and maybe it will be a good reality that people will have their own, the nations will have their own people skills and services being brought out, and they strengthen the nation. So there's opportunity for rebuilding a resilient economy and infrastructure. In terms of health services, this is a great opportunity since there is no definite cure for COVID, to focus, to have a renewed focus on preventive and promotive health. Healthcare investments, so those who are in the business field will also be looking at COVID and the opportunities for them to look at consumer-driven investments. Technology, as we have it, is now being used even more than ever before. There's a demand for that, and just this meeting that we are having is testimony to that. And therefore, even the human resource for that. So those have been existing from before, and there were opportunity to tap into and now utilize more. So there are windows of opportunity for planning and replanning in between the different waves of the epidemic. So if one wave is over with or without any restrictions or interventions being done, people should not sit complacently and think, hey, yes, we are over it. You know, it's quite possible, as has been predicted, that there will be multiple waves, and it's going to be a long haul before it really subsides, possibly, and become an endemic condition or a seasonal issue, or perhaps go away completely. We can't say for certain at this moment in time. There are opportunities to cooperate, collaborate, communicate. People and communities which had not been getting along well before, or taken opportunities of sharing information and collaborating in fighting this disease, they are now actually doing that. So there is always a learning curve that we have, and every hour and every day of the pandemic, we are learning new things. So there are learning curves that we are all in. There is opportunity now for human rights approach to undo all the ills of society in terms of the disparities and inequities. And obviously, the bright people of our communities need to be promoted for innovations. So now I'll be presenting just a case study of the small organization that I was mentioning to learn what are the challenges on the ground as we go to different communities to serve them, and what are the opportunities that are there and can be taken. Excuse me. So the Centers for Health and Education Programs. So it's a Kenyan NGO. It has a vision of serving the underprivileged, empowering them for a dignified lifestyle, and it uses various different means for that. And its mission is to empower those underprivileged individuals and communities through local initiatives and resources and involvement of volunteers willing to serve the community. A lot of details you can find on the website itself. So we use the paths of improvement in health, education, agriculture, environment, development projects, and obviously humanitarian interventions in order to empower communities for them to become more resilient to the shocks that they go through every year in terms of natural disasters, in terms of unnatural crises that they may face. But our intention is to make them resilient to that and to have a healthy community for a dignified lifestyle. So the projects that CHEPs has in place are in healthcare, the eye camps, the orthopedic camps, prosthesis, that they have increasing knowledge, awareness of the people to improve their health behavior and health seeking behavior, and obviously with supplies that would improve their health situation. In terms of education, building of schools, you can see from the picture villages where children were being taught just under a tree now have schools. There are 3 schools that have been built. Others have been supported by renovation, increase in number of classes or furniture, etc., and sponsorship of students going to university. So there are many now who have passed. There are some who are still in university, become lawyers and doctors, economists, international public health professionals, and so on. So in schools, then there is support with the furniture, with those in those villages where there's no electricity, they are provided with solar energy, solar lights. Libraries are being set up, and as needs are realized from demand from the ground, then the organization responds to it. School construction, you can see how it was before, just the mud houses and animal bones as furniture, and the current situation after the schools were made. Adult education was not left out. There was a demand from the adults of communities themselves, and CHEPs responded to it. Girls have often been missing classes, dropping out of schools. So sanitary pad project has been embarked upon. And you'll see opportunity within COVID, it's the pandemic itself is being taken to make it really a sustainable project. Agriculture projects, irrigation, animal husbandry, environment cleaning, tree planting, all these projects have been done before and are ongoing. Development projects in terms of wells for water, sanitation, toilets in public places for needy individuals, and schools especially. and houses for the elderly who are living alone or suffering without any support from elsewhere. And obviously humanitarian projects in times of drought, in times of floods, in times of the locust swarms that have come recently and are still around. Communities need emergency help, and CHEPs has been up to it. So there have been storms which have affected people's livelihoods, floods, and through that we've actually managed to even identify people in further need, especially the destitute elderly. For that. COVID actually provided a great challenge in reaching out to those people during this crisis, and I'll show you how we dealt with it. Village youth empowerment has been really helpful, especially in one village where we set up football teams, got them together, and took the opportunity to start raising their awareness about community service and improving their own livelihoods, getting away from drugs and alcohol and misbehaviors. And that has been a huge success. So here you see them playing football, cleaning up the village, that even repaired the access roads to the villages, and some were sent to learn keeping bees, and they're attempting to do that. So, okay, so far so good. Is it fine?
Yeah, it's fine. You can continue.
Okay, so our target communities for the COVID response, there were a few counties that were identified, and most of the intervention was still in Kilifi and Tana River counties. And what were the challenges that we faced? There were operational challenges due to the lockdown and curfew. In Kenya, you know, there's a nighttime curfew on, and we are hoping that we'll see some relaxation of that if the epidemic begins to show a downward trend, but it's not. It's actually on the rise over here. So what happened with the lockdown is our response van got stuck in Nairobi. We could not take it back to the villages. And initially, the supplies were disrupted. So it was a very tight situation, and we really had to think hard on how still to do it or close shop as others have done. Food distribution, it was like even before Ramadan, the hunger had already started, demands were still there, and food distribution got delayed because of the disruptions. There was a new rule that came here that anybody wanting to distribute food to communities had to seek permission from the county authorities and the commissioners, and that also became a cause for delay in reaching out to the people. And it was taken there were different barriers on the roads also to reach the villages, and there were different delays that happened even on the road. So another issue was the disease itself. Since we had to keep distancing and wear masks, it was really difficult. So as you can see in the picture, the way we used to distribute before, people would come to one big ground, and it was easy to just distribute the food in one day. But because now of the distancing rules, we had to go household to household in the different villages. And what used to take one day even took 2 weeks to do. And this is where the local youth team came very handy, because most of them were border drivers, and they were highly motivated and passionate about the work that CHEPs is doing, and joined in the effort very successfully. There was ban on construction of anything, so even the classrooms that were being constructed and the wells, all that stopped. I camps definitely stopped altogether. And there was mandatory mask and physical distancing rule, the increased demand for supplies and health education in the rural areas. Administratively, also there were great challenges. The team could not meet physically. Now we had to get used to online calls. And the change in priorities. So we already have an annual work plan that we were working on month by month. But with this, now we had to reallocate resources, we had to replan towards more COVID issues and the needs it has created on the ground. Supplies, there was increase in prices, there was reduced availability, and donor priorities also changed towards COVID, and some pledges also had changed. But most of all, what we have to consider as challenges is what is the community facing? The community had restricted movement. So they had restricted access even to health services. Schools had closed. Children were just sitting at home with no access to education. There was, just as we keep receiving for fake messages and hoax messages about COVID, there's also misinformation in the communities. And that was a big challenge that had to be taken care of. And they were very suspicious of outsiders coming in. So even when I had visited, there was a new village that I stopped at, and the moment I got out of the car, I could hear them talking to each other, COVID, COVID. So they think that those coming from outside are the people who will bring in COVID. And rightly so. That is how seeding occurs in a community where there is no infection before. Iniquities were revealed. So when the team went around, they were often told that, hey, why are you coming to talk to us about this now? Because rich people are also being affected, right? Poverty and hunger doesn't affect those well-offs, and therefore they were not dealing with it, while we have been suffering that all our lives and every day of our lives. Why do you think we should be concerned about COVID now? Because of you, because of your issues, or is it our issue? Humanitarian crisis, there's been locusts, floods, rains, storms, people have been displaced, houses and livelihoods destroyed. In terms of health, the local government dispensary had issues, not just in terms of supplies, but also their staff were going on strike because they hadn't been paid their salary for months. Right? Education, as I said, the schools were closed. So what were the opportunities that we had? We have a very small but highly passionate and very motivated team who realize the needs and who want to plan together and get things done. The community confidence in CHEPs. So over the years, since CHEPs has been there, dealing with the community issues, not just in times of crisis, but every day individuals, families come up, schools come up, the local authorities, even the county authorities call up CHEPs and discuss various issues to get to solutions, and wherever it has managed, it has actually supported and solved the situation. So the local administration also then has confidence in CHEPs. Local manpower motivation, the volunteers that I mentioned about, technology for follow-up. So technology exists, but it does not, the type that is required at this time is not there in the villages. So the children are still suffering from lack of education. So we need to still figure out how to get that done. There are certain ideas, but they haven't been implemented yet. So there are opportunities for web-based services, including telemedicine, which was in the plan for years, but hasn't been implemented. But maybe it can be fast rolled out at this time, because the demand is even more. Similarly with education. Donor relations, because of the track records, has still been good. And the enhanced hygiene practices that is being advocated because of COVID, if we sustain that and keep reinforcing that, maybe even post-epidemic, it will be useful for containment of other diseases or reduction of other diseases like diarrhea and trachoma and acute respiratory illness. And similarly with the physical distancing rule, maybe it will be useful even for other airborne diseases. So instilling in communities long-term healthy habits, changing health behavior. The annual work plan is already there, and that can be operationalized as soon as the situation normalizes. And we are taking every small opportunity, like even the classrooms, we've already started preparing, that the moment construction is allowed, the same day we'll be able to start off again. A big opportunity came with setting up mass production of masks. And I'll show you some pictures of that has already started. And the idea is that after the need for production of masks dies down or reduces, the same production unit can start producing reusable sanitary pads, which is always an ongoing requirement for girls to remain in school. So what was the strategy that CHEPs used in strengthening our leadership and management, strengthening our teamwork and communications, continuous donor communications and improving relation, maintaining relation with them, gathering information continuously through networking. Community engagement is now more than ever before, and local government engagement at the village and county levels is ongoing. So another strategy was to link the emergency COVID-related projects with sustainable plans. For example, what I mentioned about mass production going into sanitary pads production, hand washing interventions to continue for prevention of other diseases, food distribution to go with seeds, and that was done this time also, so that small-scale farmers can continue to farm even during this crisis, and taking opportunities for the already planned work. So what were the results then? The management refocus, its strategies were more rights-based approach to reduce inequities and disparities. Communications were strengthened, supply lines were established and smoothened out. Community engagement continued and was strengthened even more, and collaboration with the community and government volunteers was strengthened, and donor interest was maintained. So these are some of the glimpses of the activities done in the past, actually 2.5 months, to relieve the food shortages in different parts of the country. So over 3,000 households, and these were like reached individually, each household, not just in groups. However, in Busia, there was difficulty reaching out to individuals as we went to IDP camps, and there the whole masses, they just gathered around without taking much precautions. So to those, masks were provided from our production unit, and their awareness on the preventive measures were given out. So this is how the volunteers went house to house on motorcycles carrying, and these are part of the football team, the youth empowerment project. So last year, if you see the picture on the bottom, people from across the village, they had to cross the river. They had to cross the river to come and get their supplies, and they walked through the crocodile-infested rivers back. But this time, because of the rains, the river has been really not passable like that. So the volunteers immediately cut down a tree to make a raft, but it didn't really work out because of the strong currents. And we had to get a boat, and it took a couple of weeks to get that. In Tana River, this is how it was delivered on one side of the river, and then those small canoes came and took the food to the other side, where volunteers were waiting to distribute over there. In terms of health services, because of the food distribution, which even went to the health dispensaries staff, they were motivated to continue providing services as they waited for their salaries. And the community continuously is being advised to utilize the services, which they are, because we were worried about maternal and child health immunization services being disrupted, and that would have a long lasting effect. So we are not seeing a lot of that. There is a reduction in health-seeking behavior, but not it's not zero. Women are still bringing their babies for immunization. So hand wash stations were also set up, put in strategic places. And the new norm is there even in the rural areas, with hand washing, masks, physical distancing. But in terms of eye camps, it's a standstill. We are at a loss exactly how and when it would start, because we'll need to also put in place those physical distancing and infection prevention methods even in eye camps, and that will make it very difficult. So these are the types of hand washing stations that were made in the villages through the design that we send them, and it works. You see this one on the left. It was an early design. It was improved upon later, as you can see now in the middle one. Right. So hands-free. You don't want cross transmission of the virus. That was in Busia County. This was in Kindubay. Now it also shows the power of WhatsApp. So remotely, we managed to send them this poster of how they can make it. And a simple villager actually got it done. He made it and then got somebody to send me the clip. And this is what they did. Okay, so in terms of education, children really are suffering. There is disparity between urban, rural, rich, poor schools, whereas the rich schools are getting the privilege of web-based learning. There's no such thing in villages. Infrastructure development, digging of borehole, identifying the elderly for housing, roads being smoothened out for access to the villages were done. So in conclusion, COVID is a new disease and it has spread to all parts of the world. It has affected all aspects of our lives and created new norms. Nobody really knows what the future will hold for us. And there are lessons from the past that we can use in containing this pandemic or living with the new norms. There are challenges, definitely, but there are also opportunities that we need to take and adapt our lifestyle, edit our systems, and creatively find new ways to get closer to our vision. What are the lessons that this organization learned? The key is teamwork, passion for service to humanity, information, data is really key. Without data, without information, not much good can be done. It would be totally top-down approach and not engaging with the grassroots communities, finding out their needs and then planning and then acting at the right time in the right way, in the right place. And being with the community in thick and thin, engaging with networks really helps. So for the future, what do we need to do? There are different scenarios that are there. We can discuss that in another session. And we need to plan for the different scenarios and adapt ourselves and our systems and our lifestyles towards those different scenarios. So what will work in the future, we'll be able to then live with that. There may be disasters due to the pandemic, but also the possibility of more resilient communities and health systems. Thank you. I'll end over here.
Thank you very much, Dr. Muhsin, for such an informative presentation. And congratulations for the amazing work your organization has been doing. So right now I'm going to open the floor for questions. So if you have any questions, you can raise your hand or you can just write it down in the chat section. So I'll just read it out. So I can see Farhan, you have a question already. So you can go ahead.
Okay, thank you so much, Uruj, and thank you so much, Dr. Muhsin. A great presentation. So Dr. Muhsin, I think for the benefit of everyone on the call here and also for those who will watch the recording later, since we have someone who's been in the public health field for such a long period of time, I often get this question from the younger sort of health professionals, those who are still studying around. So what is public health? What does a career in public health look like? Like, how is it different from what we are studying? So I think, you know, leveraging on the immense experience that you have, maybe we can hear a little bit about, you know, from your perspective or in your words, what is public health and what would be your advice for younger professionals who are thinking about specializing or, you know, getting into that field. I mean, as a community, I think we definitely need more public health professionals. And the second question that I have is that I think another challenge that I have seen is that many a times, unfortunately, so even in the medical field, we work in silos. So the clinicians have their own silos that are limited to hospitals, and public health professionals have their own silos that are maybe in community. Do you have any advice on how we can sort of bring those two worlds together? So how can clinicians work better with public health experts to sort of improve health outcomes in general? Thank you.
Do you want me to answer that now, or are there other questions?
So we can answer this one, then we can see if someone has any other question, then we can go ahead with that.
Yes, and sorry for the long presentation. I had intended that we get more time for Q&A, but when you talk about the public health work that is being done, I lose myself in that. So
It's totally
okay,
fine.
So what is public health? There are definitions for that, but how do you describe it is so difficult to describe. I'll just mention my experience with trying to understand what is public health, and maybe that will help. So initially, when I was working in Dar es Salaam, and you'll remember I was in Temeke, the way that I used to work was different from what a usual clinician would do. I was in management. I was going around walking the streets, watching how what people do, and children on the streets, if they are it's a school day and they're not in school, I would talk to the families, their mothers, and see. And I realized that there were so many different issues which affected health of people and health of communities. There were human rights issues, there were inequity, disparity issues, but I could not structure it. I could not think deeper into that, but I did realize through experience that was there. But it was like an interest, a passion, that the reason why I became a doctor. So I did my first MPH. It was in management and policy focus. That was the only focus that they had in Muhimbili when they had started. They might have different streams now. And it gave me a good idea that, yes, now I understand this is where I need to go. And the rest is history, right? And I've never looked back. And what you saw, the examples that I gave of this organization, the work that is being done is all public health, okay? Because it improves lives and livelihoods and lifestyles, individuals and communities, health, and the purpose why we want health for the people, right? So I will stop there, lest I go on another hour. But if people are interested in that, then individually also they can call me up, email me, send me a message. I'm on your group, MHI. We can discuss even on that. But feel free to do that. And remember, what I realized, there are more subspecialties in public health than in clinical medicine. Right? So whatever interests, whatever your heart then takes you towards, it's like strategic planning, it's data related issues, it's leadership and management, it's policy making, it's international health, it's academic research. These are all areas of public health. And then there's so many more. When you get into it, then you realize that how many subspecialties there are. Okay, the second question now is really very interesting. That globally, we've been trying to tackle How do you integrate different work? But let's try to analyze this and respond to this from your perspective of if you are a clinical clinician and you want to work with public health, how do you do that? And many people are doing it. There are these, in these advanced countries, they have MD, MPH combined courses. And the reason for, and I know many who have that from my university, and it's, and the reason that that is there is need to really collaborate better together. So all the research information that is coming in, how does it translate into clinical work? All the statistics, what does it mean for in your individual patients? You need to sit with the public health professionals, discuss and make sense of that. What are the determinants of health? You are doing a great job in your clinic, in your hospital, in your clinical work, seeing individual patient. But you need to know why that patient even got sick and had to come to you. Are there people who are similarly sick and cannot come to you because there are barriers to that? So those are all issues that a public health professional can actually advise, find out and advise on. So that's public health work and collaborating with clinical. So on that one point, I'll stop my answer to this question. Is that satisfactory or do you want more?
No, Dr. Saab, thank you so much. I mean, I guess, and we'll see, maybe if there are no other questions, we can come back to this and maybe you can share a few examples of how you've seen that happen, like even within your sort of practice and all that, because I often struggle, personally, I'm more on the public health side, but I often struggle on creating that bridge. So if there are any specific examples, but we can come back to that if there are no other questions. We can leave it for now. Thank you.
So if anyone has any other questions, you can raise your hand or just write in the chat section. But I have a question. So how can we make sure something like this, like a pandemic like this, doesn't come up again? Like which areas should we be prepared in to make sure something like this doesn't come up again?
Very interesting and challenging question. It's not that people didn't know before also that there is a chance that there will be another pandemic. What scientists had been saying before, what leaders had been saying before is now taken up by those conspiracy theorists to say that, look, it was already planned and everything. It's not like that. There are certain parameters that they had watched in communities globally that can lead to another pandemic. So, for example, lifestyles, diets, the inequities in societies, disparities, housing conditions, transport, the manner and the speed with which people are traveling, global travel within countries or international travels. So if all these are watched, then the reason for rapid transmission globally, it's there. It just needs a small bug to be seeded in, to be infused into humanity, and then it can spread all over the world because of all these reasons and others. Now, what are the chances that a new bug gets like zoonotic conditions, right, from animals or other places getting into humans? It's our interaction with the environment. Deforestations, exploring mountains, destroying natural habitats, and human beings go and stay over there. And the way cultures and interactions between human beings and societies go. So all that leads to it. So all those need to be managed. There are things that cannot be controlled, like travel has to happen and it has to increase. There are other reasons, more better reasons to travel than not to travel. With increase in population, there's space requirements, they have to go. What about the urban slums? How do you deal with that? So all of those have their own different ways of managing it, and that might reduce the chance that even if a bug comes, it doesn't spread as much. There are examples from previous pandemics how recently they were controlled. SARS and MERS and others, and they were contained, and it did not cause the kind of havoc that this current pandemic can cause if it continues longer. Thank you.
Thank you so much. So there was one question on the Google form. So I just wanted your opinion on that. So the question was, what could be the possible reason for decrease in number of cases and or mortality in Tanzania, particularly after reduction of COVID-19 testing, reporting, and less precautions being taken?
I was hoping all of you with more experience actually in that situation would be able to say. Actually, the whole world's eyes are on Africa, and scientists are trying to figure out actually what's happening, and there seems to be some good in that it hasn't so far hit as badly as it has the countries it has hit previously. In Europe, in US, and other countries. Even in Southeast Asian countries, Pakistan, if you see the way they're suffering right now. So African countries, all the predictions that had been made, they haven't turned out to be accurate. So is it to do, as I had mentioned in one of the slides, the African advantage, that it's a more youthful population, population densities is high in just certain spots in the few cities, but majority, the population density is not that much. Does it have to do with the weather condition? Just yesterday I was discussing with somebody on this, and I explained the situation, and I said what could be. He said whether possibly humidity, if it's on the coast side, could humidity be a factor in making droplets heavier? Haven't read much about that, but if any of you find that kind of literature, please also pass to me. But as much as this has been good, weather is not considered such a strong factor. You might have read the paper published just a few days ago online, discussing about the different theories that what could have happened in Africa that has led to this situation. And especially Tanzania is a big factor. Could it be that people themselves were out of fear, were taking precautions, so that is the effect that we are seeing. But now there is some kind of relaxation. So let's watch the next few weeks to see whether that could have been a factor in that. And obviously we know that if there's no data coming, data is key to begin to understand. Right now we can just theorize, maybe it was this, maybe it was that. But without data, we cannot tell much. So that is why most countries really are having their daily briefings, giving out the data, or there are technical people who, even if the data is not publicized, are actually looking at it and giving the right advice on what to do. So all in all, we still have to really advocate for the public health measures that are known to reduce, so that if the next wave is going to come, we can really contain that. Also, just as you did the first wave. Right? Thank you. I'll stop here.
Thank you so much. So if anyone has any other question, you can just ask it. So if there is no more questions, so thank you very much, Dr. Muhsin.
Thank you. It was a privilege, really.
Yes,
I feel very proud.
it was a very informative session, and I'm pretty sure all of us learned a lot. And so the session has been recorded, and it will be uploaded on our YouTube channel. So if you want to share the channel with your friends and ask them to subscribe to the channel. So thank you for joining us. Khudafis, stay safe. Thank you.
Khudafis.